Sir, can I start now, sir? Okay. Good evening, everyone. Today's my topic is the Bartter syndrome, a rare renal tubulopathy. Coming to the background, the Bartter syndrome is described by Bartter and his colleagues in 1962. It is a primary tubulopathy that represents the hypokalemia, hypochloremia, metabolic alkalosis with failure to thrive. It presents in neonatal period and infancy, but the diagnosis can be delayed up to the adulthood. Bartter syndrome is an autosomal recessive disorder that affects functioning of the thick ascending loop of Henle. Different genetic types of Bartter syndromes are associated with different genetic mutations. Coming to our a 21 years old male presented with complaints of weakness of both upper limb and lower limb. He is born out of a consanguineous marriage with hearing and speech impairment since childhood. His antenatal and postnatal period were uneventful. He had no history of trauma, no history of exposure to toxins, and no history of similar complaints in the family. His vitals are, at the time of presentation, his vitals are normal. Nervous system examination is normal except for the power 4 by 5, where spine and cranium were normal. When coming to the laboratory investigations, serum electrolytes showing hypokalemia 1.7 millimole per liter, hypochloremia 88 millimole per liter. His renal function tests were normal. Urine pH is 7, which is neutral, and urine spot potassium is 28 millimole per gram creatine, which is greater than 50 millimole per gram creatine. Urine calcium and creatine ratio was very high, up to 600. His arterial blood gas analysis shows a pH of 7.5 with bicarbonate levels of 36.7 millimole, which shows a metabolic alkalosis. His complete blood picture are normal. Thyroid profile were normal. Plasma renin activity shows 10.8 nanogram per ml per hour, which is high. Serum magnesium and serum calcium were normal levels. On this background of chemical history and investigation, we made the diagnosis of Bartter syndrome, which is a classical of hypokalemia, hypochloremia with metabolic alkalosis with normal blood pressure and normal magnesium levels. We made a diagnosis of Bartter syndrome, but genetic studies were not done in this case due to non-availability of laboratory investigations in our region, sir. And coming to the discussion, currently 4 causative genes were identified. Based on this, it is divided into 4 types: type 1, type 2, type 3, and type 4. Type 1 and type 2 have mainly impairment in the calcium reabsorption, which is not seen in type 3 and type 4, whereas type 1 and type 2 are considered as antenatal Barters, which is present in newborns who are failure to thrive, and also presented with the history of had a history of polyhydramnios and premature delivery. Classical Barters, which is of type 3, Barters type 3, which is usually present in the first decade of life, which having features of hypokalemia, metabolic alkalosis, and recurrent episodes of dehydration, with a few cases have a renal magnesium salt base, which may mimic Gentleman syndrome. Whereas type 4, which is characterized by sensory neural hearing loss, as our patient has a hearing impairment since childhood, we are keeping it as type 4 Bartter syndrome. Coming to the treatment, correction of dehydration and electrolytes is the mainstay of treatment. And the introduction of prostaglandin analogs inhibitors like indomethacin at the 1 to 3 milligram per kg per 24 hours can interfere with the pathological tubuloglomerular filtration in Bartter syndrome by as it decreasing the delivery of sodium and chloride to the distal nephron. Treatment results in reduction of polyuria, polydipsia, and improved growth activity and better control plasma electrolytes. Conclusion. Recurrent or persistent hypokalemia in normotensive present in the absence of diuretic or laxative abuse should arouse the possibility of Bartter syndrome. High judicious treatment is high index of clinical suspicion is required for timely diagnosis and judicious treatment, which has been shown to improve the prognosis and prevent various complications. Thank you. Hello.